Coming up on Healthy Living, more people are living longer after a cancer diagnosis. We'll discuss how they can live life to the fullest. Then, important lifestyle tips for helping to prevent the cancer from coming back. And learn more about resources available to cancer survivors in the Northland.
Your health questions answered. Welcome to Healthy Living, brought to you by the experts at Essentia Health.
Good evening, I'm Michelle Lee, and welcome to another edition of Healthy Living brought to you by Essentia Health. New federal data indicates that about 1 in every 20 U.S. adults has survived cancer. And thanks to early detection and treatment, the number of survivors continues to grow. While survival is every patient's goal, patients are faced with living a new normal that includes more doctor's visits, a lifetime of tests, and coping with fears the disease could one day return. Tonight we address the important topic of cancer survivorship and what that means for patients in our community. We begin tonight with pediatric oncologist Jacqueline Wiermaa, who treats patients at the Eric Peter Person Children's Cancer Center. And thank you very much for joining us this evening. First off, doctor, can you tell us what does it mean to be a cancer survivor?
A cancer survivor is someone diagnosed with cancer at the moment of diagnosis, throughout their treatment, and then the balance of their life. So typically we're talking about not only the patient, but also their family and friends that are directly impacted by cancer.
I see. Are more people living longer after a cancer diagnosis?
Currently, about 67% of adults are 5-year survivors of cancer, and about 80% of children are cancer survivors. So it's increasing because of research.
I was just going to say, is that simply a matter of research or new treatments or both?
I think most of it is the clinical research that we're doing.
Now, recently, the Essentia Health Cancer Center hosted a local conference for cancer survivors. Can you tell us more about that?
Sure. About 18 months ago, the Essentia Health Survivorship Committee started planning this event, and it took place at the end of March. It was a half-day event, and we had people talking about different issues of cancer survivorship. We tried to address 4 domains of cancer survivorship, so some of the physical late effects that you can have after cancer treatment, some of the emotional and psychological effects, as well as some of the spiritual and social effects. We had speakers and just a way to build community and relationships about these issues.
Was it well attended?
It was full. For our first event, we were very pleased.
Was there anything that really stood out in your mind of what people really wanted to know?
I think just building the relationships of knowing where to go to for when questions come up, I think was the most important thing I saw.
Absolutely. Now, you specialize in the treatment of childhood cancers. What are some issues facing those children?
About 2/3 of children that have cancer have a late effect. So even though the survival is excellent, over 80%, we know that 2/3 will have some sort of medical late effect after their treatment. And the main reason is children are a lot more susceptible to the toxic effects of chemotherapy because their bodies are still growing and developing. So it depends on what type of cancer they had, how they were treated, the doses of chemotherapy and radiation. But we will often see problems with learning and school issues. We can sometimes see growth problems, fertility issues, much higher risks of getting a second cancer, and then sometimes organ toxicity, heart and lung, etc.
Now, you talked about maybe slower in learning. How does that impact school and later life?
It can be more challenging, but usually they learn coping resources and adaptations to improve their performance. And so we find that even though some areas are affected, other areas can be augmented to kind of balance out in the end.
And what about social issues? Is it difficult for a child to become a cancer survivor and then move on with their social lives?
Not at all. They usually have no problem. Kids live in the moment, I find, and they don't worry about it, and they tend to want to go to school the whole time. They tend not to worry about any of that. So I don't see that as a problem. What I see as a problem with children is they often don't remember specifics of their cancer treatment, and so we have to educate them when they're becoming adults to be real proactive, that they have a treatment summary, that they let their healthcare providers know they had cancer and the specifics of it, so that if late effects come up, it can kind of be part of the assessment to see if it's related to their cancer. I also find that sometimes it's hard for survivors to take the initiative with their health care. A lot of times a parent or caregiver, because they've been so involved, will continue that involvement even when they're adults. And so just trying to become more independent.
Certainly, and when you hit 18, you might go off to college, you start your own life, and sometimes you want to leave that cancer behind.
Correct, and you can't, because it may affect many different things in the future.
What about some adult issues? What are some of their concerns as far as being a survivor?
Sure, adults aren't quite as susceptible to the medical late effects. They still can have all the same things as children, but they're not quite as susceptible, and obviously the learning and the growth issues aren't going to be as prominent. But they can still have chronic fatigue. There can still be some problems with memory. There can be problems with just neuropathy, which may be painful. There may be problems with organ toxicity. Sometimes infertility can be a problem in that group of patients. So it's the same medical effects, just less likely, but they are more likely to have problems with relationships, fear of recurrence, economic impact of their cancer. So it's a little different than the childhood late effects.
Why is this topic so important to you?
For a couple of reasons. For children, because 80% are surviving, they may have 70 more years to live after they're cured. And so we want to make sure the quality of life is as good as possible. And if 2/3 are having late effects, that's an important topic. So it's just to make their lives better, not only to cure them, but to have a good life after that, or is help them as much as possible with that. And the second reason is we're not as advanced on the knowledge for adults, and so I'm trying to use the information we know from pediatrics and trying to help the adult oncology practice kind of learn from each other, so we can learn from each other, basically.
Okay, well, thank you very much for joining us this evening. We certainly appreciate having you here.
Thank you. I appreciate